Okay, here it is. It's my turn. I feel a big range of emotions, but mostly it is absolutely excitement and gratitude.
Let's talk about Rachel Tussey. Rachel was a 47-year-old woman who underwent a mommy makeover surgery in late February this year. The surgery was 9 hours and it was done in a surgery center. In the recovery room, she was given 150 micrograms of fentanyl and 0.5 milligrams of Dilaudid. Shortly afterwards, she stopped breathing. The husband said that the nursing staff was slow to react and give her oxygen, and she was without oxygen for several minutes. About a week later, her husband showed us an update with Rachel intubated. Her life support was removed about 2 weeks after that video.
She was without oxygen for over 6 minutes, supposedly. I don't know how that happens. To me, it looks like incompetence. If the doctor would have been there, this wouldn't have happened. Or if we'd have been at the hospital, it wouldn't have happened.
Rachel's lawyers say that she was given a massive overdose of opioid medications, but the surgery center says that this was a baby dose of medication for pain relief. They also state that her brain injury wasn't opioid related because she didn't respond to Narcan. They also state that the cause of death is unknown, could have been cardiac, could have been a pulmonary embolism, and we don't know the cause of death because an autopsy wasn't done. The twist here is that her surgeon is now suing both the staff, the anesthesiologist, and the surgery center in a separate lawsuit. The surgeon alleges that the anesthesiologist was unavailable and abandoned the patient. The reason for the separate lawsuit is
Dr. Tork's practice has suffered immensely because of this situation.
and the surgeon himself said this.
I've never lost a patient. I would be seeing her smiling in my office if other people had done their job right.
If you're not from the US, this might be shocking, but we sue for everything in the United States. Even so, I have never heard of a doctor suing another provider, a nurse, surgery center, etc., for providing bad care. Can you imagine a nurse caring for a patient who needs surgery, has a complication, and then that nurse then sues the doctor for it? It really sets up a bad precedent. And if this surgeon is successful, I would hope that the money he gets from any settlement or judgment would go towards the patient's family or some sort of patient compensation fund. This was a 9-hour major operation. Now, this surgery center had overnight stay capabilities, meaning they were able to stay there overnight, but nonetheless, it's a pretty major surgery to have in a non-hospital setting. As a spine surgeon, only about 15, maybe 20% of my cases would qualify for a surgery center. That is, the surgery is small enough and the patient's healthy enough for them to be done as an outpatient. The rest are done in the hospital, but that number is always changing. We're always doing more and more as an outpatient setting, but we still need to balance the convenience of a surgery center with patient safety. If you want to donate to Rachel's family, her GoFundMe is linked here.